Hi everyone, and in this video I'll be discussing drugs for cough. So whenever we think of cough, there are basically two types of cough we need to manage. One is what we call it as the dry cough. So in dry cough there is no sputum production because of upper respiratory tract infection. Usually we see dry cough. And one more is called productive cough. So in productive cough, what is there is sputum production is there. So let us manage this dry cough and productive cough. Now please understand the dry cough has to be suppressed. In the productive cough, we have to make the sputum come out. So let us see what are the drugs for that. So drugs for dry cough. What are the drugs? How do you suppress that? Number one, we use a drug called opioids. So opioids, the drugs what are used for dry cough are codeine, and one more drug is called folcodeine, and one more drug is called levopropoxyphen. These are the opioids. But the problem, the drawback of opioids, if the patient takes it, what are the adverse effects? Obviously, opioids will produce sedation. Second, they can produce constipation to the patient. And patient may abuse these drugs, And if you use this drug at higher dose, patient if he takes it higher dose, there is a chance of respiratory depression that is seen with higher dose. So that's the reason these drugs should be used very carefully. And because it causes respiratory depression, they are not used in children, not used in pediatric population. These opiates are not used. So what are the other drugs what we have for this? The other drugs which are used for dry cough, it is called the NMDA antagonist. Even the drug is derived from opioid, the mechanism is different. It's an NMDA antagonist. So the name is called dextromethorphan. The name is dextromethorphan. Now this dextromethorphan doesn't produce sedation or whatever, constipation. So no or less chance of sedation, abuse, and respiratory depression. These are very less or not at all seen. So can we use it in children? Yes, you can use it in children also. So that is dextromethorphan. Now there was a question in your exam, can we combine codeine plus dextromethorphan together and give to a patient? Can I give codeine and dextromethorphan and tell the patient that if this has high efficacy, you can use it? No. This combination is irrational. Why the combination is irrational? Now why did we come with dextromethorphan? So it doesn't have abuse, it doesn't produce sedation, constipation. But if I will combine with codeine, the adverse effect will come back and there is no advantage. So this combination is obviously irrational. Recently we have come up with a drug called benzonatate. Now this is a local anesthetic and it has two actions. One is in the brain. It has a central mechanism to suppress cough. And also it has a peripheral mechanism in the lung. It inhibits peripheral lung stretch receptors. So the name is benzonatate and it is a local anesthetic. It has central mechanism to suppress the cough and also it inhibits peripheral lung stretch receptor. It is called benzonatate. So basically we have three important drugs to suppress cough. Number one, opioids, codeine, folcodeine, and levopropoxyphen. Number 2, we have NMD antagonist that is called dextromethorphan. Number 3, we have a local anesthetic that is called benzonatate. So these are the drugs for dry cough. Now moving on to the drugs used for productive cough. So the problem in productive cough is there is sputum produced from the lungs. Now what is the problem if sputum is inside? If the sputum is inside, if it is not coming out, the infection will flare up. So first of all, we use a drug called expectorants. Now what is the role of expectorants? They increase the expulsion of sputum from the lung. They increase the expulsion of sputum from the lung. So they will throw the sputum out. And the example for this is guaifenesin. The name is guaifenesin. And one more drug is called ammonium chloride. So these are the expectorants. Apart from that, we have certain drugs called mucolytics. Mucolytics. What is the role of mucolytics? They will make the sputum just thick sputum. Now the problem with thick sputum is it will not come out of the lung. So what you have to do is make the sputum thin and watery. So these drugs will make the sputum thin and watery sputum. So that is what they do. So what are the mucolytics we have? We have a drug called ambroxol and a drug by the name bromhexin. The name is bromhexin. What do they do? What do they do? They depolymerize the mucopolysaccharide in the sputum. So when you do polymerize the mucopolysaccharide in the sputum becomes thin and it's easy to expel out. The other drugs are carbocystin and a drug called acetylcysteine. So carbocystin and acetylcysteine, they break the disulfide bond in sputum. So by breaking that disulfide bond, they will make the thick sputum into thin. Now do you remember acetylcysteine somewhere else? Acetylcysteine is also used to treat one more. It is also the antidote for which toxicity? It is also an antidote for paracetamol overdose, that is acetylcysteine. So these are the mucolytics, expectorants, the drugs, opioids, NMD antagonist. Please don't exchange the cough syrups. Suppose a patient comes with dry cough. If you give a productive cough syrup, what happens? Dry cough will increase because the syrup, expectorant mucolytic, they try to induce cough and throw the sputum out, even there is no sputum. If a patient has productive cough and you gave him dry cough syrup, what happens? The cough is suppressed, the sputum stays inside, and the infection will flare up. So you have to diagnose carefully and then use it. So this is about drugs for cough. Thank you all.